Welcome to another video. In this video, we will continue learning pharmacology, starting with anti-anginal medications. Anti-anginal medications. The use of organic nitrates, beta-adrenergic blocker agents and calcium channel blockers to treat pain-related imbalances between myocardial oxygen supply and demand. Since we already learned about the other medications, we will now learn about organic nitrates. Organic nitrates relax peripheral vascular smooth muscle, resulting in dilation of arteries and veins, thus reducing venous blood return to the heart, which leads to decreased oxygen demands on the heart. They also increase myocardial oxygen supply by dilating large coronary arteries and redistributing blood flow. There are 4 main medications you must know for exam purposes. Those 4 medications are sublingual tablets, sustained release tablets, transdermal ointment and transderm unit, which are patches. These medications are used for acute angina attack or as a prophylaxis of chronic stable or variant angina. Note that these medications are contraindicated in clients with head injury and contraindicated if the patient is taking erectile dysfunction medication, which result in a life-threatening hypotension. There is a high hypotensive risk with all antihypertensive medications. The side effects of these medications are the following: headache, orthostatic hypotension, reflex tachycardia, and tolerance. Now, let's learn about the nursing actions for each type of medication. Here are the nursing actions for Nitrostat, nitrolingual. Administer sublingual. Teach the patient to rest for 5 minutes if pain is not relieved by the first tablet. Call 911, then take a second tablet. May use up to 3 tablets taken 5 minutes apart. Keep Nitrostat an original dark container. Nitrolingual may be used prophylactically 5 to 10 minutes before exercise. Do not shake nitrolingual canister because it forms bubbles. Replace tablets every 6 months. Wear medical alert identification. Nitrobid. This is a topical ointment. Wear gloves for administration. Do not massage or rub area. Apply to areas without hair such as the chest, flank or upper arm, which is preferable. Cover the area where the patch is placed with a clear plastic wrap and tape in place. Gradually reduce the dose and frequency of application over 4 to 6 weeks. Nitrodare. This is a transdermal patch. Skin irritation may alter medication absorption. Optimal locations for patch are upper chest or side, pelvis, and inner upper arm. Rotate skin sites. Usually worn for 12 to 14 hours, then removed. Well, that's it for this video. In the next video, we will continue the lesson by learning about antidysrhythmic agents. Thanks for watching. Help this channel out by liking and leaving a comment.